We are facing a toxic drug supply crisis where the drugs that are on the street are much deadlier than they were even 5 years ago and are becoming more deadly all the time.
Urgent action to save lives. Calls for the declaration of a public health emergency here in Manitoba over what community members say is a drug poisoning crisis that's only getting worse. Representatives from the Manitoba Health Coalition, the City of Winnipeg, and Moms Stop the Harm stood outside the Manitoba Legislative Building Monday, calling on the provincial government to change their approach in dealing with what they are calling a toxic drug supply crisis.
Last year, we lost 400 people in Manitoba to an overdose. The majority of those here in Winnipeg. This year is shaping up to be worse.
Thomas Linner, director of the Manitoba Health Coalition, says Manitoba is uniquely hostile to harm reduction efforts already being used in other provinces, like safe consumption sites and decriminalizing small amounts of drugs for personal use.
This is a crisis that is in every corner of Manitoba, every corner of our city. If you think your neighborhood is immune, you're wrong. People are dying every day.
So since this government has been in place, we have lost over 1,600 loved ones to drug-related harms and to a poisonous drug supply.
Arlene Laskobe, regional director of Moms Stop the Harm, lost her son to a fentanyl overdose in 2014. Laskobe wants Premier Heather Stephenson to declare a public health emergency under the Provincial Public Health Act and shift the focus of treating those battling addiction into a public health issue instead of a criminal one. She also wants the province to invest aggressively in harm reduction strategies.
We want a safer supply because it's better than the option out there, okay? We know that in safe consumption sites, people overdose, but they don't die. But we know that people die here every day alone.
According to the Government of Canada, the benefits of supervised consumption sites and services include reduced risk of accidental overdose, reduced strain on emergency services, and increased opportunities for treatment options. Premier Stephenson says addiction issues have increased during the pandemic, and her government will keep investing in support services that she says have a proven track record.
We're continuing to put more supports into things like ground clinics to ensure that we get those individuals off of the addictions and can heal in the community as well.
For Linner, that's simply not good enough.
The fact is that the face of addictions has changed, the face of overdose deaths has changed, and so it's time for our province to change in our response to it.
In Winnipeg, Mark Neufeld, City News.